Hello guys, welcome to my YouTube video. How are you today? I hope you're all good. Before starting this video, I want to introduce myself. My name is Bagus cahyadi. You can call me Bagus. In this video, I want to talk about trauma-related disorder. Even though I'm not an expert in this topic, but I want to share information that might be useful for you guys. For the first, what is trauma-related disorder? The trauma-related disorder are serious psychological reactions that develop in some individuals following exposure to a traumatic or stressful event such as childhood neglect, childhood physical or sexual abuse, combat, physical assault, sexual assault, natural disaster, or even an accident or torture. There are several characteristic symptoms or disorder that associated with trauma and stress that can be divided into four broad categories. First, intrusion symptoms include recurrent, involuntary, and distressing memories, though dream of traumatic event. The individual may also experience flashback, a dissociative experience in which they feel or act if the traumatic event is reoccurring. Second, avoidance symptoms are effort to internal, like memories, thought, feeling, or even external, like people, places, situation, reminder of the traumatic event. Preoccupation preoccupation with avoiding trauma-related feeling and stimuli can become the central focus of the individual's life. The next is the negative alteration in cognition and mood include problems remembering important aspects of the traumatic event such as depression, fear, guilt, and shame, feelings of isolation from others. The fourth is hyperarousal symptoms include being jumpy and easily startled, irritably angry, self-destruction behavior, problem of concentrating, and difficulty sleeping. Now that we know the symptom, for the next, I will discuss how many types of trauma-related disorder are there. The first is post-traumatic stress disorder, or PTSD. PTSD is one of the most well-known trauma disorder. The individual develops PTSD following a traumatic event. While it's common for initial symptoms to begin in the day following a traumatic event, symptoms can even begin to surface 1 month later. In order to receive PTSD diagnosis, you must experience certain numbers of symptoms from each category for over 1 month. The next is complex PTSD. When individuals are exposed to repeated follow-up trauma such as childhood abuse, they develop slightly different conditions known as complex PTSD. These share many similarities to post-traumatic stress disorder. The third is acute stress disorder, or ASD. It's similar to PTSD but is shorter in duration. ASD symptoms develop immediately after a traumatic event and the last 3 days to 1 month. If symptoms beyond a month, the individuals has developed PTSD. The fourth is secondhand trauma. Secondhand trauma is also known as trauma exposure response or secondary traumatic stress disorder. It results from exposure to the first-hand trauma of the other people. The next is reactive attachment disorder, RRD. Reactive attachment disorder occurs in children who cannot form stable attachment to their caregiver. If a child's basic needs are not met or they are frequently placed with new caregiver, they are at increased risk of developing cahyadi. This condition can be devastating to childhood normal development and may impact their life into adult. The next is disinhibited social engagement disorder. Children who were unable to form healthy attachment to their caregiver may develop disinhibited social engagement disorder instead of reactive attachment disorder. While these two conditions have the same roots, the symptoms are completely different. The next is adjustment disorder. Adjustment disorders are usually temporary and triggered by stressful life events such as divorce, job loss, being diagnosed with illness, or losing a loved one. Some people are able to cope with the stress or the situation on their own, but the others need help from a doctor or mental health professional. Last but not least, other and unspecified trauma and stress related disorder. You might have some of the symptoms of a trauma disorder, but not meet with the criteria for one of the recognition type. You might not be able to provide enough information for the specific diagnosis. In this case, professionals often make diagnosis of other or unspecified trauma and stress-related disorder. This diagnosis is not any less serious than other trauma disorder. People with other or unspecified disorder have a legitimate mental health condition that is diminishing their quality of life. If you are experiencing mental health symptoms that seem to be connected to trauma or stressful life event, the good news is that you can be treated. It may take a combination of different things, including traditional talk therapy, holistic therapy, and medication. And talk to your doctor or mental health provider to see what might be the best treatment option for you. I think that's all for me. Before I closing this video, I want to remind you again that trauma related disorder are serious problem, likely serious problem, and must be treated immediately. Thank you for your attention. Stay healthy and see you.